So diagnosis, a lot of ways to diagnose this. Serological tests, and there are a lot of them, and they can be confusing if you don't really understand how they actually work. Animal history is very important. Community and herd history is very important, and microbiological culture. You notice the 3-starred ones. These are very important information to get from the field. So if you're a field veterinarian, you have a role in not just drawing a blood sample, but you have a role in also addressing the animal history in the community or herd history. If you come to me and say, I got a positive blood test, does this animal have brucellosis or not? I need a lot more information. You know, what test, first of all, but the tests are not foolproof either. So as a matter of fact, you can get a lot of false positives and a lot of false negatives. So the rest of this information is really, really important in trying to determine what's going on here and do you have a disease process or not. Blood and serum, ideally, I always tell people to collect about 5 milliliters of blood. This is your ideal sample. We want to run it on serum samples. Most brucellosis tests will not work very well in a hemolyzed sample. So handling that is important, and you need to train your field personnel to collect a sample appropriately and handle it appropriately so we can get a good testable sample. When we're looking at the positive serology, if you have a positive blood test, first question they always want to know is this infected or not? One of the things that I'll look for first is to find out why are we testing this herd? Okay? Are we testing it because we have a retesting of an animal that was positive before? Or it's an animal that came out of a known infected herd? Did it abort? All of these kinds of questions are really important. These top ones, contact or exposed animals, area community testing, and an area of infection, are indicators to me that I better pay attention to this blood test. Because you have to look at the prevalence in the area, and then you can kind of look at some predictive values here and see if it's probably infected or not. If it's tested because they're selling it, or it's going to a show, or it's certified, I have a little less of an indication that it's probably infected, although it certainly can be. But the test reason, if I've got a test sample from an aborting heifer in a known area that's had infection before, I'm on high alert. Okay. So as I mentioned, there is no perfect test. This is my really crude sample thing I drew on. I like to simplify things that are complex. The reality is some are false negatives, some are false positive. Small percentage of them, but they do happen. So we need to do some additional work to figure out what's going on. Especially if you have like one positive out of 1,000 animals and the herd has been negative for years and years and years in a negative area, probably not brucellosis. If you got 5 positive out of 10 and they're all aborting, pretty good chance it is. Could be other things, but pretty good chance it is. But there are other things that can cause it. Obviously, field strain infection, that's the real bug. But there can be other cross-reacting things, Yersinia pastorella, Salmonella, Leptospira. If you got mastitis in these cows, if you just vaccinated them with leptospirosis vaccine, some of these other things can trigger a positive test, some of the tests, some of the time. So you need to ask these questions about what's going on. And of course, there's human error, there's laboratory error, which can complicate things. So you always need to make sure your laboratory systems are working adequately and that you have proper proficiency testing, et cetera, so you can trust your labs. But there are a lot of reasons why you can get a positive blood test. That's why whoever goes out to the field to draw that blood sample needs to not only write down why they're drawing that blood sample, but what else is going on out there. How old is that animal? Is it a female? Has she been vaccinated if you use vaccine? Where'd she come from? Has she ever been tested before? Especially if you're going back to retest a positive animal. This kind of information needs to be collected in the field while you're there. And because that will help your epidemiologist, whoever is interpreting your test, have enough information to really make a correct assumption of what's going on. Just a test blood sample in a tube, to me personally, is not really that helpful when I'm trying to assess what's going on. So when you train your people to go out and get the blood sample, train them that they're not blood sample takers. They are veterinarians or they're technicians who are supposed to get all of the information to help you make a diagnosis, not just to collect a blood sample, okay? Especially with this disease. The other thing is to find out what's going on in the community or of the herd itself. You know, how big is it? Are they having any abortions? Where do they get their replacement animals? This is especially true if you have positive animals or previous history of positive animals. Find out, are they positive? How old are they? Are they all the pregnant heifers that are positive? Or is it 1 or 2 9-year-old cows that have been there forever and have mastitis? See the difference there? Same blood sample, entirely different picture. So when you go out there to collect these samples, be sure that you train your people to understand how the disease works and to get this additional information. Otherwise, it's really hard to sit in a lab or sit in an office and decide what's going on and maybe really impact that farmer's livelihood. Because if you're going to take his animals, you better be pretty darn sure he's got a real disease going on there. Because you really, really seriously impact some of these farmers. So the other thing is I always like to ask is who's on the other side of the fence? Okay, because this disease goes back and forth across fences. And I'm going to show you an example of exactly what I'm talking about in just a minute. But if you pay attention to the index herd only, and you don't look around at what is this sitting in a pool of brucellosis, or is it just an isolated herd off by itself someplace? Because these, in a community, these farms will swap brucellosis back and forth. So you can work really hard and clean it up in one area, and if you guys got somebody sitting over there on the other side who's a pregnant heifer who's maybe where they got the disease from in the first place, it's going to come right back. So you've wasted your energy and your effort, and you're going to have a farmer who doesn't think you know what you're doing or who doesn't trust the program. And once you lose that trust of the farmers, it's very, very hard to get it back. So if you put them through a lot and cost them a lot, clean them up, and they're reinfected again from their neighbor, it's going to be very hard to go back and start that again because they don't see the purpose of it. They say, I'm doing all this work, I got it all cleaned up, and I got it again. So why bother? Just leave it. You know, just leave it. And you don't want that response when you go back out there. Brucellosis culture. Culture is the only way, the only definitive proof that brucellosis exists. Okay? The idea is to collect a sample of milk or tissue. Again, remember where it lives. You got to collect those tissues, lymph nodes, udder, uterus, etc. And you have to sample them correctly, handle them correctly, and then your lab needs to be qualified to be able to run these tests because this is a human pathogen. So if you're going to try culture, which is a very, very important tool in my mind, you need to make sure that your labs and your lab personnel are properly trained and take the proper precautions so they don't infect themselves. But it's a really, really important piece of brucellosis. You don't know if you're dealing with melitensis or if you're dealing with abortus. And sometimes there are different biovars. For example, if you can culture it on down, and you can see I've got a biovar 1 on this farm and I've got a biovar 2 on this farm. Are they infecting each other? Probably not. There's probably another source somewhere. So if it's biovar 1 on both sides, you probably got a swap thing going on. I'm really simplifying it, but that's how knowing what you're dealing with proper culture can really help you in understanding. So let's move on to prevention, control, and eradication. So epidemiologic investigations can be very complex. Let's break it down to 3 questions. Where did it come from? What management factors allowed it to spread? Where did it go? Okay? Epi 101. This is what you really, really want to find out. So where does it come from? It comes from animals, generally. Most people buy it. That's the most common way of getting infected is people buy it. Either they don't test them or they're buying heifers that are during that incubation period and they buy it. The other common areas, as I mentioned before, is retained heifers, keeping those heifers in that herd. Those are the most common places from where it comes from. It always comes from someplace. So if you're dealing with an infected herd, find out where it came from so it doesn't come back and reinfect what you're dealing with. If you only focus on that index herd, you're going to be very frustrated after time because it's going to keep coming back in most cases. Most people still buy from the same place, or they still keep their heifers. If you don't do something to understand where it came from and change that practice, then you're going to keep dealing with brucellosis forever. Brucellosis is a community disease. And I keep saying this because it's so important. So many people deal with the index herd only without looking at what's around it. And I've got village here because this is where I don't know if you call them villages or not, but most of the places where we work that we talk about the fact that if you put all your animals together like this, I think I took this in Republic of Georgia, people in the village put all their animals together, they all do their eating thing all day long and then they go home. Well, if you got 5 farmers there and one's got infected animals and you only test his animals, You got 4 more farmers whose animals are part of that herd. So you don't look at who owns them. Look at what's the unit that's being kept together, that's spreading it. So to prevent it then, you just go back to this, pretty obvious. Make sure they've had a negative test. Don't buy it. Ideally, isolate them 30 days. Why? Average incubation period, right? We don't just pick a day. You know, you base everything, all your decisions on how does this disease work. The average incubation period, you guys cheated, it's right there, forgot I put it there. Okay, average incubation period is about 30 days. If these are pregnant heifers they're buying, are you going to do anything different? Yes, what? Test before calving. Why? Because they're going to spread it when they calve, right? So are you going to throw them in the herd and then test when they calve? No. Isolate them. Yeah, thank you. You guys are doing great. I'm going to go home. If animals are pregnant when they purchase, keep them isolated until they have a negative post-calving test. So the timing of your testing is important with this disease. You don't want to just test them just for the heck of it and say, oh, I got a test. Remember why you're testing them. Okay, what's the purpose of it? What's the timing? What's the purpose of it? So if you have an outbreak, now how are you going to address this, okay? So going back to how does the disease work? All right, it spreads at calving. It spreads by heifers. So when you do a herd plan, and this is actual herd plan we were developing in Armenia, where we just lay out where do the animals move, where are they when they calve, you know, how did they get infected. You look at it like it is a diseased herd. You can't necessarily cookbook, all the principles are the same. You address these specific areas. And then your testing schedules will vary depending on which animals you're dealing with. Yeah, you can test a whole herd every 30 days, but what if you have like one herd I dealt with that had 30,000 cows? What are you going to do? Test every 30 days? No, it took a year to test them. So where would you focus your efforts then? Heifers and pregnant animals. Okay, you keep testing those pregnant animals and those heifers. Yes, you do test the rest of them, but not nearly as often. So you focus your efforts on your risk areas. So, and you look at your replacement animals. So what happens if you have an infected herd and you bring a naive animal in? Where is its susceptibility level going to be? It's negative out of a herd that's never seen brucellosis, and you put it in this herd. What's this? Very susceptible, totally naive, okay? So be very careful because they will perpetuate the disease too. If you add them in there, bam, they're going to get infected, especially if they're pregnant, because a lot of people will buy pregnant replacements, right? Throw them in the herd. Vaccination practices. These are the general things, if you're going to try and get it out of a herd, that you need to pay attention to. So we're going to pay attention to 2 parts of this. You saw how the disease works. So when we're trying to stop transmission in an infected herd, we want to stop four-legged people, from getting infected, and you want to stop them from transmitting it, right? Those are the 2 areas you want to stop when you're going to try and get the disease out of the herd. So first of all, to get any disease gone, first you have to be able to find it with good surveillance. Then you have to stop the transmission. Once you stop the transmission, then you can eliminate the disease. 3 easy steps. If you don't stop the transmission, you're probably not going to eliminate the disease. Okay, so we focus on those 2 ends of the cow. So calving management is very important. This is when they're going to spread it. So separating these animals when they calve, disposing of the placentas in dead or aborted calves. One of the big mistakes a lot of people make is they take the placenta and they'll toss it to the dogs. Okay, free protein, right? So what's the problem with that? They're going to drag it somewhere else to eat it, right? And they're probably going to drag it under the fence and away from the crowd. So they're dragging brucellosis right along there. All right? So cleaning and disinfecting. So let's just look at an example of why this is so important. And what we're trying to do is minimize the amount of work we have to do. Okay? I'm basically a lazy person. I'm going to do very hard work what I have to do, but don't give me extra work if I don't have to do it. Okay? 100 cows in a single calving. Now, the idea is every 30 days we test till we get negatives, right? So we're going to have to test these 100 cows every 30 days, right, in theory. Now let me show you how to simplify it. If we got 1 animal that aborts there, now we got 1 positive and we got 99 exposed animals. So in 30 days we've got to test 99 animals, okay? Now, what happens if we split that pasture? We put them in two different places. Even if you just take old bed springs and split those animals up if you have to. So what happens now? We got 50 cows in two groups. We get one abortion. How many exposed animals do we have to deal with now? 49. We got 50 unexposed animals. Now I'm greatly simplifying this because if they're across the fence, you still need to deal with them. But the concept here is you got 49, now I got to come back in 30 days and test 49 instead of 99. Now, if you take this and put another fence right here or separate them into another area, so you got 25, 25, and 25, how many are you going to need to retest in 30 days? 24, okay? So by paying attention to how a disease spreads and adjusting your management to that, you can greatly simplify your work and focus a lot more on the animals that you're worried about. Heifers, we've talked about this. They're very risky animals. They can test negative up until the time close to when they calve or abort or even later. So serological tests are not very reliable in unbred heifers. So the ideal thing is if you have an affected herd, especially if it's a dairy like this, is to separate those heifers someplace away from the main herd and ideally have them calve individually if possible. It's not always possible. None of this is always possible in every herd. I know that. But when you explain to the farmers all the things that they can do that will cut the transmission, and they understand what you're trying to do and why, they'll work with you generally. If you tell them if you do this whole list of things, then we can get this out of your herd very quickly. If you can only do one or two, we're going to still clean it up. It's just going to take a lot longer. Then they're going to find ways generally to start separating these animals or isolating them at calving. So keep these animals separate. Then you have to just focus on blood testing these animals really frequently as they get closer to calving so you can identify the positives and remove them. You may only have to test them every 30 days till you get negative, and then maybe 60 days, and then maybe 6 months later. You want to keep your tabs on there, but they're not calving right now. So your focus then, all your efforts go over here. Vaccination is a great tool. It has to be combined with good herd management. We use RB51 in cattle in 4 to 12 months of age in the U.S. We don't use it much now because we don't have any brucellosis left, but we used to use it extensively. The good thing about this is it slows or stops abortion, so it's a great help if you have a big abortion storm going on. And it raises resistance. Notice again, I did not say makes them immune. It just raises the resistance. They get enough dose, and that will override that vaccine. So if you go out there and you just say, well, we got lots of infection, let's just vaccinate everything, and that will take care of the problem. It will not. It will help reduce the infection level in most cases, but unless you do some of these other things, you're not going to get rid of it. Adult vaccination is using a lower dose in these animals, does a couple of things, reduces abortions, and it increases the resistance. So that combination of things starts to cut that transmission again. So if you have adults that are especially in a heavily infected area, adult vaccination is a good tool. It's also a good tool in those herds that can't be tested as often, those 30,000 animal herds where you can't get in there and test every 30 days. Just another tool. But take-home lesson, and I've argued with a lot of people about this and say, well, just vaccinate everything. I said, it will not work. It will get you down to a certain level. But I've never seen a case where it's gotten rid of it completely in a huge population. It will in a herd occasionally, but not in a full population, okay? It's got to be combined with good management in order for it to work completely. And I'm talking eradication. I'm not talking about reduction. I'm talking about eradication from a population. Herd replacement animals, we already mentioned that. They're very susceptible. Test them, isolate them, vaccinate them if you have to add them to an infected herd. Preferably not to add replacements while the active infection going on. That's not always an option, especially in dairies. Testing schedules, I already said, tailor it to the individual herd in the environment. Base it on the disease situation within that herd. If you don't have options on that, then every 30 days is a good rule of thumb. The ideal thing is to work within normal management practices if possible. Farmers hate to get their cows up extra times. So if you can time it when they're already going to be doing something else, that's the ideal time to do it. If you can't do it as often as you want, then do a pre-calving and a post-calving test. Why? Why pre-calving? Take the infected ones out before they calve. That's what we're trying to do, right? Not after. Why post-calving? What?
Keep the negatives.
Keep the negatives. Yeah, keep the negatives. The other thing is there are some of those heifers that won't test positive until after they calve. Yeah. And there are also a few times when an animal will be so overwhelmed that she'll actually override how the test works, and she'll test negative until after she calves and she tests positive. So if nothing else, try and do that. Generally 30 days works well. If you got active abortions going on, do it at 15 days in that group or 10 days in that group, whatever you need to do to stop that abortion spread. Removal of positive animals is critical. If you're not, I'm going to stick my neck out here and say, if you're not going to do anything with the positive animals, don't even test them. Why? Why test them if you're going to leave them there? You know they're there. Is that a good way to spend money? Have a plan if you're going to test for what you're going to do with the positives, and then do it. Spreading out, so we talked about coming in to the herd. We've talked about keeping it from spreading within the herd. Now let's talk about how does it get out of a herd. Sales, leases, heifer sales is huge. Adjacent or community spread, animals jumping the fences. So this is why you need to look at that whole community as a whole if you really want to get serious with it. And as I mentioned before, don't let the dogs drag it around. They're mechanically going to carry this infection from one place to another premises often. So bottom line, what does the farmer need to know? And you too. Number one, don't buy brucellosis. Test first. Okay? It's the most common way people get it is they buy it. Number two, it's spread at the time of calving or abortion, so manage it there. That's where you're going to stop it from. Cleaning and disinfection of calving sites is critical to prevent transmission, especially in dairies or confined areas. When you've got animals nose to nose, you really got to clean that area up. Number five, brucellosis can cause serious illness in humans. The farmers need to know that. You need to know that so you don't pull a placenta out with a bare hand. Number six, milk products from potentially infected animals should be boiled or pasteurized before consumption. Okay, very important if they want to protect their family. Number seven, when slaughtering potentially infected animals, precautions should be taken to minimize the risk of transmission. Okay, so we talked about milk, we talked about sticking your hand in that rear end to get the placenta out. The other thing is when you cut those animals open, you cut that uterus open, if she's pregnant, bam, you can really get yourself infected. So if you're going to be slaughtering them, be very careful. Know where it resides in the animal and be careful when you slaughter that. The last thing is brucellosis is a disease that spreads in a community. If you'll remember these take-home points, this is a really, really good way to get started on it.